Good afternoon. I'm pleased to be here to provide an overview of Bill 66, which is the Public Health Amendment Act, which I'll be introducing in the legislature this afternoon. The health and safety of all Albertans is and will always be our top priority. And that's why Alberta's legislature created the Special Select Public Health Act Review Committee to review the Act and see if it can be improved in light of our experience during the COVID-19 pandemic. Now, during its review, the committee heard from many Albertans and received hundreds of submissions. Albertans told us that we could improve the Act by strengthening checks and balances on government authority, protecting the rights of individuals, including the right to refuse immunization, and doing more to help manage chronic diseases. And we've taken the recommendations to heart, and we're addressing these concerns in the proposed legislation, as I mentioned, Bill 66. There are also a few items that were raised by the committee and are not included or modified in the proposed legislation. The committee asked that government establish an expedited appeal or review process. This is outside the scope of the Act and therefore was not included in what's included in Bill 66. The recommendations included affirming individual rights in the Public Health Act. This was omitted as the Alberta Bill of Rights is paramount. So there's no need to include this as part of the proposed amendments in Bill 66. And finally, the committee recommended that the Act be reviewed every 5 years. And this was modified to every 10 years to allow for adequate time for review and consultation as well in between reviews. I want to once again thank all members of the committee for their work. They listened to Albertans, and their recommendations will make the legislation better. Now, last spring, Alberta faced an unprecedented situation as COVID was spreading rapidly around the world. When we declared our first public health emergency in March of 2020, there was real concern that the Legislative Assembly would be unable to operate normally. And at that time, the government introduced the Public Health Emergency Powers Amendment Act, known as Bill 10, which further expanded emergency powers in the Public Health Act that had existed since 2002. The Public Health Emergency Powers Amendment Act clarified emergency powers of ministers to modify legislation by ministerial order to ensure that vital public services could continue to operate even during the pandemic. Albertans expressed concerns that these ministerial powers were an overreach. And what we've learned over the last year is that the Assembly was able to adapt and to meet throughout the pandemic safely. The legislature has continued to successfully debate, and the government has passed critical legislation to support lives and support livelihoods through this extraordinary time. And this was all done without the need to use the expanded authorities that were included in Bill 10. Last fall, I committed to repeal all sections in the Act that authorize a minister to modify legislation by order. The amendments introduced today will do just that. In fact, they'll go further, to also repeal the power of a minister to modify enactments, which was added to the Public Health Act back in 2002. Now, I want to be clear that while the proposed amendments repeal these authorities, this bill will not affect the current public health measures or limit our ability as a government to respond effectively to the pandemic. Checks and balances play an important role in the balancing of protection of public health with individual rights. Many of the proposed amendments in Bill 66 enhance individual rights and create additional safeguards while maintaining the government's ability to respond to public health challenges. If passed, Bill 66 would remove the authority of government to mandate immunizations or conscript individuals to support a public health emergency. Albertans told us that these are excessive authorities that infringe on their civil liberties. Alberta's approach to encourage immunization is focused on education, information sharing, and providing data-driven evidence to support Albertans to make their own informed decisions. Additionally, we've clarified and enhanced individual rights in the Act, and this includes First, ensuring that individuals are informed of the location if they are being detained, establishing criteria that must be met before requiring someone to be treated or examined, and last, establishing criteria for how public health information is collected or disclosed under the Act. Albertans are clear that they want transparent information sharing from government when responding to a public health emergency. And Bill 66 includes new requirements to publish orders that apply to the public or groups to be published online. And this would help increase Albertans' awareness of the public health measures and make sure that they can find information quickly on what measures are in place. Additionally, as recommended by the Review Committee, we're making periodic review of the Act a requirement. If passed, the Act would be reviewed every 10 years to ensure that it can continue to address the public health needs of Albertans. The recommendations of the Special Select Committee included amending the legislation to better reflect current and emerging public health challenges and practices. And we've taken the recommendations and found additional opportunities to modernize the Public Health Act through this legislation. Now, these changes better reflect the province today and what we've learned through the COVID-19 pandemic so that we're better positioned for the future. And this includes establishing the qualifications of the Chief Medical Officer of Health in the Act, which is in line with what other jurisdictions in Canada do. It would also clarify orders to reflect the ability for employees to work from home where possible, so someone under an isolation order is not limited from working from home if they can do that. The amendments would add sections to the Act to address chronic diseases as well as preventable injuries, and this will provide a framework for health promotion and prevention activities and will allow a focused, collaborative, and coordinated approach to chronic disease and injury prevention. As part of these modernization amendments and to support the government's red tape reduction initiative, we're also proposing to repeal Section 70 of the regulated matter regulation. And this means that Albertans who use inhalants as an intoxicant will no longer be fined for their addiction. And these measures are unique to Alberta and are inappropriately punitive for vulnerable Albertans. Alberta's government has made recovery-oriented treatment for people who use substances a priority. And removing these measures will support recovery rather than enforce fines and imprisonment. Now, I want to thank those Albertans who shared their thoughts, as well as their ideas and feedback and input on the Public Health Act. Their important feedback shaped the amendments I'll be introducing later today. And Bill 66 balances the rights of individuals with measures needed to protect public health. And striking that right balance is a priority for Albertans and a priority for this government. Thank you very much. I'm happy to take any questions.
Thanks, Minister. It's a House day, so we'll need to make the Q&A fairly quick. Reporters, please limit yourself to one question and one follow-up. So with that, we'll take the first question, please.
Lisa Johnson, Edmonton Journal. Hi, good afternoon. Thanks for taking my question. I'm wondering specifically about the committee's recommendations here. The committee, the majority report recommended that the Act be amended in relation to how certain clauses can be interpreted, specifically kind of narrowing in on definitions of in the public interest, extraordinary circumstances, significant threat, those kinds of phrases that are used. But they did not recommend that those specific parts of the Act that gave the minister extra powers during emergency be repealed entirely. So I'm wondering if you can explain how, why specifically you're moving on this. I mean, obviously there's been public pushback on it, but I'm wondering if you can explain exactly why this is happening, because it wasn't recommended by the committee.
Sure. Thanks, Lisa. It's exactly because that's what we committed to Albertans. It was throughout 2020, we heard from Albertans. This was the first time we had a public health emergency. And I don't think many people knew the emergency powers that were included in the Public Health Act, going back to amendments that were made in 2002 after 9/11. And I think that the feedback that we got from Albertans about making amendments to legislation through ministerial order was a concern for Albertans. We made the commitment to making that change and removing those emergency powers. We've also seen throughout the pandemic that the legislature still met. And so there is continued opportunity for us to meet as a legislature and pass emergency legislation when it might be needed in a future pandemic without having to do it through a ministerial order, still allowing members of the Assembly to pass legislation and doing their jobs as legislators.
Thanks. Follow, Lisa?
Sure, and I'm sure there might be some more questions about this, but I'm wondering why is this bill including a specific reference to chronic disease and preventable injuries? Why is legislation needed for that? Because it seems like this would be the normal work of Alberta Health regardless. Why do we need legislation on this?
Because it's missing in this legislation for our version of the Public Health Act. Other provinces do include this in the jurisdiction within what they might call their Public Health Act equivalent. Some of them call it the Health Promotion Act, Health Prevention and Promotion Act, and variations of that. And they include the ability for government to monitor preventable injuries and chronic diseases, where that's not included. So enabling the public health officials and the chief medical officer of health to do that monitoring is going to allow us to modernize the Act and put us in line with what other jurisdictions are doing in Canada. Thank you, Lisa.
Thanks, Lisa. Next call.
Rob McNally, CTV.
Hi there. Thanks for taking my call. This is vaccine related, and I'm hoping you can help with this one. The Premier unveiled the timeline today projecting 64% of Albertans will be immune by the end of June. But with most Albertans just having the one dose by that point, how does the province calculate and define immunity? And will that be a percentage that's publicly available moving forward?
Well, thank you, Rob. So what Premier was communicating was the hope that we have as we go through the transition period, as we have the vaccines now starting to come into the province. The numbers that you saw include those who have received the vaccine after a 2-week window of time, because we know it takes 2 weeks for that protection to be built up, as well as the natural transmission, although we thankfully haven't had a lot of that in Alberta as opposed to other jurisdictions like we've seen in the United States who have had a lot of natural transmission. So we will, so those are the numbers that were provided by Premier publicly at that presentation.
Thanks. Follow, Rob?
Yeah, just a quick follow, same topic. And the Premier also expressed concerns about the AstraZeneca uptake. And last week, Saskatchewan made it available to people above 55. We're seeing, low wait times at drive-through clinics. And I'm just wondering what you're seeing thus far with uptake and how will hesitancy towards AstraZeneca impact your rollout?
Well, the rapid flow-through clinics are just now opening, so we will continue to monitor the situation. Thankfully, we have a lot of folks who are not having long periods of wait times for them to be able to access the AstraZeneca vaccine, which is good news. We're happy to make sure that we're getting those vaccines in the arms of Albertans as quickly as we're receiving them, and we'll continue to monitor if there are any issues. But we look, I just, again, for me to use this as an opportunity for people to understand that the reason to take a vaccine isn't just for us, isn't just for me as an individual, but also for all the vulnerable people around me. That's why I'm going to be taking the vaccine when it's going to be available to me. It's not just for me. Obviously, we're going to continue to look at and judge the efficacy of vaccines as it protects us against severe outcomes, but it also is going to help us with protection in transmission as well. And we don't always know that even when we are sick, and so it's going to be important for as many Albertans as possible to get the vaccine, because it doesn't just protect us, it protects the vulnerable people around us. Thanks, Rob.
Thanks. Next caller. I think we have 2 more on the line. We should be able to get you both in. So next, please.
Janet French, CBC.
Hi there. Thanks for taking my question. Hoping to hear from you a little bit about the unsuccessful agreement with the Alberta Medical Association. So I talked to Dr. Boucher on Friday, and he listed some of the reasons why doctors had turned down this contract, including no ability to have binding arbitration, really lack of detail about how pay might be withheld if you went over budget, and the sort of relationship that the AMA has had with the province over the last year and a bit. So in which of these areas, if any, is the government willing to be more flexible in its next round of negotiations?
Well, I think Dr. Boucher has also made it clear that the next steps for us, and I had a great conversation with him last week, that our focus in the short term and medium term is for us to continue working, building on the momentum that we built up since November, and continuing to work on priorities that both we and the AMA have to improving outcomes for patients and for physicians. And so I look forward to working with the AMA on those priorities. That's going to be our focus in the short and medium term. And being able to I think there's an opportunity as well for us to speak with physicians and his members to go over what it exactly was in that agreement, because as you said, there was a lot of misunderstanding of what was in that tentative agreement, and I think being able to walk through with physician members what was in there and what might be in a future agreement. Thank you.
Thanks. Follow, Janet?
Yeah, I just want to follow up on what you said there. Where was the misunderstanding about the tentative agreement? And Dr. Boucher also said that he considers a negotiated deal with doctors to be essential. Do you agree with his perspective that Alberta must have a negotiated deal with the AMA?
Well, I think there was. It's going to depend on the physician, but the feedback I got from both staff of the AMA as well as Dr. Boucher that many physicians didn't fully understand what was included. There were significant increases in how, for example, surplus might have been provided to physicians as grants, how we're going to work with the AMA on further grants and benefit programs to be provided to support physicians in their offices. And I think there's a great opportunity for us to be able to first have those opportunities to meet with physicians. And, well, actually, let me say this. I think the first priority is, as I said, working with the AMA on those priorities we identified in the short term and building on the momentum that we've had since November. The momentum we had from November to March in working on drafting that tentative agreement and continuing to work together to improve outcomes for patients, as well as continuing to provide the stability and the predictability that physicians want to see in the framework and how physicians are compensated in this province. Thank you.
So thanks for that. I think we have one remaining caller, so we'll take that one, please.
Catherine Grugowski, Alberta Today.
Thanks for taking my question, Minister. To follow up on Lisa's question on these chronic conditions, how do you intend to use that? I know other jurisdictions have had, say, a diabetes strategy that includes a sugar tax. How do you plan to use the chronic conditions in this act?
Well, let's remember that the Public Health Act isn't one piece of legislation that deals with every health initiative or every health priority. But what it does provide is allowing the Chief Medical Officer of Health to monitor these types of issues. We know that communicable diseases, when the Public Health Act started, if not a century ago, a lot of what's currently in it is existed for decades. And when these versions of the Public Health Act were first drafted, the number one health risk for Albertans at that time was communicable diseases. We now know that chronic diseases and preventable injuries are much more of a strain on our health system and much more of a risk for Albertans. So we want to be able to enable the Chief Medical Officer of Health to do that work, to do that research, to do the monitoring, so that we can continue to be responsive as a government, and to also be able to address some of the financial strain on the health system that these chronic diseases and preventable injuries can put on the system.
Thanks. Follow-up, Councillor?
Yeah, thank you. For a follow-up, could you please explain or give an example of some of these preventable injuries or chronic conditions that may be monitored for?
Well, you mentioned diabetes. I think that's a perfect example. And so allowing the chief medical officer of health to do that monitoring and to develop a health plan so that that work can be done and that provide the advice to the government to continue to be responsive is a perfect example, Catherine. Thank you.
Okay, that's it. I think we got through all the calls on the line. So with that, we'll wrap up. Thanks very much all, and thanks, Minister.
Thank you, everyone.